A very interesting question, which I always like. So this is why I smiled is because traditionally laparoscopy and robotic surgery was not commonly done in cancers
Yes.
because it was feared that the cancer treatment will not be adequate, as in the whole cancer may not be removed. The
Okay.
reason being that this minimal access surgery or laparoscopic surgery, as it is called, or
Hmm.
the or robotic surgery,
Yeah.
these procedures were invented in non-cancer cases. Like,
Oh,
for
okay.
example, laparoscopic surgery started with the gallbladder surgery to remove gallstones.
Okay.
But as like man is a evolving creature, as we say, so people started operating on cancers also. And
Right.
many of the initial proponents of laparoscopy in cancer surgeries were not cancer specialists.
Okay.
So the outcomes used to be poor.
Okay.
Now, what has happened all across the world, including India, many of the cancer surgeons, like for example, I got trained in cancer surgery first and then
Yeah.
laparoscopy and robotic surgery.
Okay.
So, what it has helped us do is we choose. So, basically, instead of using a blanket statement that open surgery is good or laparoscopic surgery is good or robotic surgery is good,
Yes.
what we do is choose the right technology for the right patient. So for example, in complex surgeries, a laparoscopy may not do a very good job,
Right.
but a robotic surgery, if you are doing in that aspect, is a very helpful tool. So
Hmm.
to give you an example, like in cervix cancers
Okay.
or in rectal cancers, where we have to operate deep down into the pelvis, or prostate cancer, where the robot was first used.
Okay.
So these organs are very deep down into our pelvis.
Yes.
So with laparoscopic surgery, there is a limitation negotiating that space. So in these cases, though robotic surgery is costly,
Hmm.
it provides a technological advantage.
Yes.
And
Yes. Yes.
also, if we are able to complete the surgery by robotic, it provides a big benefit to the patient
Patient.
because,
Yeah.
like recently, like every month we do robotic cases, we do laparoscopic cases. So like I had a recently a lady who was 72 years old,
Wow.
and we did laparoscopy surgery in her.
Hmm.
And next day she was just walking about the room and she's like, "Doctor, आपने कुछ मेरा operation किया कि नहीं?" That was the kind of response she had.
The next day, the very
Yeah,
next day.
because the incisions are less than 1 centimeter in size. Those are muscle splitting rather than muscle cutting incisions. So the pain is
Oh,
very less. And
okay.
though the intensity and the scale of surgery is the same as open surgery, the
Right.
biggest problem of pain and discomfort which you get is
Hmm.
not because of the surgery done inside, it is because of your skin incision.
Correct. Correct.
Because our pain receptors are mainly in the skin
Skin.
and the
Hmm.
muscle. So that is where your main pain lies.
Hmm.
So cases where you can do the surgery by laparoscopy or robotics,
Always better
and
option.
the biggest in quotes remark would be it should be oncologically adequate and oncologically safe. That means
Correct.
the amount of surgery which you do by laparoscopy and robotics should be the same as what you're doing in open surgery. Then
Okay.
only using a new technology is justified in cancer, because in cancer what matters most is survival. The biggest criteria is survival,
Survival. Yes.
and wherever possible we try to give as good a quality of life as possible.
Managing the disease.
Yeah.
Managing mostly.
Yes. So laparoscopy robotics helps in that. And now, what has happened is with awareness, some people have in India it's still not common, but like places like Japan where the stomach cancer is very common, they have a screening protocol in place where every 6 months or a year people get endoscopies done.
Correct.
So then, if you have a very early disease, so
Hmm.
stage one esophagus cancer, stage one stomach cancer, stage one colon cancer,
Hmm.
in certain selected cases of the stage one cancers, if it is involving only the superficial layers of the organ,
Okay.
we are able to just dissect that tumor from endoscopy. Like we just put in an
Okay.
endoscope, and there's special equipments along with the endoscope where you dissect that much tumor.
Right.
So without a scarless procedure, the patient is operated. But then
Wow.
here, A, because of lack of awareness, and two, because you don't have a centralized government system or anything,
Hmm.
you don't get very early cases coming in.
Yeah, that's the thing. That's the main thing.
And the biggest problem which we face is like usual our mentality, including I would say mine also.
Hmm.
We don't seek a doctor until the symptoms start.
That exactly.
Unfortunately, in cancer, the symptoms and the quantum of disease don't correlate. So the
Hmm.
most, like the usual thumb rule is the most superficial cancer, for example, a breast cancer
Hmm.
or a skin cancer, is detected early, because what happens, it is on the external part of the body. Even if you don't have pain, you sometimes feel that. Oh,
Yeah.
I'm feeling a lump in the breast. I'm feeling a black mark on my skin, which is increasing. So it's easier to identify.
Yeah.
The more deeper you go in the body, because it's an open space, we don't realize. Ovary cancer, 80% of our patients we see in third stage. Lung
My God.
cancer, 80% of the patients are seen in fourth stage.
Hmm.
Unfortunately, like for certain things, screening helps. Like for colon cancer, you have fecal occult blood. For breast cancer, you have mammography. For
Hmm.
cervix cancer, you have pap smears.
Yes.
For lung cancer, there's something called as a low dose CT scan, which is now being tried. So
Okay.
certain cancers we have, but for certain cancers we still don't have, like
Don't have.
pancreas, liver. We don't have tests to check that.